Day and welcome to another episode of My Story. I'm your host, Janella Carrera, and thank you for joining us. In this episode, we sit down with some medical experts in the field of surgery. Our guests for this episode come all the way from Taiwan. They're here in Guam to give a lecture on surgical procedures as it relates to cancer. We first sit down with Dr. William Tzu Liang Chen, who is the Director for Surgery at the China Medical University Hospital in Taichung, Taiwan. Our second segment will feature Dr. Yao Cheng Wu, who specializes in breast cancer surgery, and of course Dr. Ming Sheng Li, who specializes in bariatric and metabolic surgery. So stay right there. We'll be back with Dr. Chen after this short break. Day and welcome to another episode of My Story. I'm your host, Janella Carrera. We have a very special show for you this evening. We have some special visitors all the way from Taiwan who are here in Guam for a conference to talk about cancer. Joining me tonight for the first segment of our episode is Dr. William Chen. He's the Director for Surgery for China Medical University Hospital in Taichung, Taiwan. Welcome to the show, Dr. Chen. Thank you for being here.
Thank you.
I know that you also serve as the official spokesperson for the hospital.
Yes.
But by practice, you're a colorectal surgeon.
Yes, I am.
I'm going to start with your title as spokesperson for the hospital, because I know that also, as a spokesperson, there's a lot that you do for the hospital in terms of promoting it and to educate the community about the things that your hospital does. Can you tell us a little bit about the hospital and what they do?
Well, the hospital is located in the central of Taiwan, and we are an academic medical university hospital. We are ranked as the #1 private medical center in the entire nation.
Wow.
So our job here is to promote our surgery, to bring better surgery here to Guam, to serve the Guam people, and eventually, hopefully, we might get a partnership.
Oh, that's great.
With the Guam Memorial Hospital.
Okay, that's wonderful. And so I know along with you were some speakers, some doctors who spoke about cancer. Can you tell us about how the Guam Medical Association, because I know they're the ones who reached out to you, how that partnership was formed to bring the many doctors out here to speak about cancer?
Well, we were here in last March. We visited Guam on behalf of doctors from Guam Memorial Hospital, which Dr. Lizama, Larry. And he came to us and see that if we can provide better surgery for the patient of Guam here, because we see that lack of surgeons is indeed the problem here in Guam. So we met and he visited our center, and then he went back and he was impressed by what he have seen in Taiwan. So he wants us to come and give some talks on minimally invasive surgery.
I see. Okay, and so minimally invasive surgery, can you maybe just give us a little bit of a brief description of what exactly that means? There's surgery and then there's...
Surgery, traditionally, for example, for colon cancer, you have to open up a large incision through your tummy, and then you do surgery through that large hole. For minimally invasive surgery, we call it keyhole surgery. It's by placing a trocar, several trocar into your abdomen using a camera, and you do surgery like the way you're doing open surgery.
Oh, okay, but
you're less trauma to the patient, and with fast return to normal life.
So are you looking at a camera as this is happening?
It's like you're playing with Xbox. You know?
I
so
see.
It's like you're watching TV and then you do surgery.
Wow, that's I've heard of minimally invasive surgery, but to actually hear about what it takes to do that.
Right.
What kind of training do I imagine someone who wants to be a surgeon goes to school, gets the training in surgery, but to be specialized in minimally invasive, is there some kind of other training that they have?
Yes, we have to go through extensive training on minimally invasive surgery, from a dry box, which using a box, and you started training it out with like some kind of rings, and you try to grab the ring, and to train the hand-eye coordination. Yes.
Right. Okay.
And then you go through like wet lab, such as like animal trainings, and sometimes we do it with cadaveric trainings.
I see. So in this sort of, I guess, partnership, possible partnership with GMH, would we be seeing more visiting doctors from Taiwan coming to
Hopefully
Guam?
that we can bring our surgeon here. Majority of our surgeons in Taiwan are U.S. trained, not necessarily U.S. qualified,
Right.
but we spend some time here in U.S. to have our training, and then we establish a better programs back home. And currently, I think we are at the stage of bring out our medicine or surgery here to Guam.
Okay. Now, in terms of the medicine that China Medical University has accomplished with minimally invasive surgery, can you tell us about the successes or the rates as far as how well it's done for you guys?
For MIS, we call it minimally invasive surgery, that we perform almost every day.
Wow.
About 90% of our patients go through minimally invasive surgery, except for transplantation or emergency surgery, like such as obstruction of the bowel. We can't place a camera in it, and otherwise, almost all the surgery can be done MIS.
So, like for example, you need to remove a tumor,
a tumor or gallbladder or appendix or like hysterectomy. We do it minimally invasively. Yes.
And the success rates on them are far better, would you say?
It's
than
much better
traditional?
than traditional surgery in terms of return of bowel function and cut down the hospital stay, as well as the estimated blood loss. That will be decreased, and it's for short-term outcome of the surgery is much better than open surgery.
What would you say to maybe, I guess, those in the community who may eventually need surgery? Is there some type of, I guess, to seek that type of care? Is that more preferred than traditional surgery?
Yes, in Taiwan, majority of the patient will come to you and ask for minimally invasive surgery, which is spread it out by the media or patient itself, himself or herself, that all the patients who come into our clinic, and they prefer minimally invasive surgery.
Okay. In Taiwan, I'm not too familiar with the healthcare system there, but is there like a cost to it? So, in other words, would someone be able to say, you know what, I want to get MIS as opposed to traditional surgery, but get the same type of rate, or is there a higher cost to MIS?
It's a higher cost in MIS, but fortunately in Taiwan we are in a national health insurance. They reimburse the surgery, except for some certain special instruments that you have to pay it out of your own pocket.
I see.
And there is a copay for the surgery. Yes.
Okay, but in the health insurance in Taiwan, I imagine is pretty.
Yeah, it's better.
Universal.
Yeah, it's universal. There. Yes, only one system there.
Wow.
Only one health insurance. It's the government.
Wow. Well, perhaps the U.S. and
yeah.
and
well,
Guam
you have
might
Obamacare.
Right.
So.
That's right. Right. But
Yeah.
Here in Guam, it doesn't. Obamacare doesn't extend here. Okay. Well, now as a colorectal surgeon, I imagine that like you said, most of the surgeries that you perform are all MIS.
Yes.
Even with colorectal.
Yes,
surgery?
in colorectal surgery, which my department, I'm a colorectal surgeon. We do majority of our work using minimally invasive surgery, including robotic surgery, which we call it Da Vinci surgery, and 90% of the patient receive this type of surgery.
What's the time difference between, say, for example, a removal of a gallbladder, traditional versus MIS? How much shorter or how much longer is traditional
Well,
surgery?
at first, when we first started, I think it takes a lot of time to complete a surgery using a minimally invasive technique. But for now, I think the time difference is cut down shorter as, like we said, the more you do, the better you are.
Right.
Now I think the time difference is about 15 minutes.
Oh, okay.
So it doesn't really
15 minutes
matter.
shorter or
longer than
oh,
open
okay.
surgery.
Okay.
But the patient recovery is much
Much
dramatically better, than
better.
open surgery.
Okay.
Yes.
How long has China Medical University Hospital been performing MIS?
About we started out MIS in 1990, late 1990s,
Oh, okay.
but for colorectal we started out 10 years ago.
I see.
So I have been each year we perform about 800 cases.
Wow.
So we have done about 8,000.
That's
maybe.
amazing.
Yeah.
That's amazing.
Using minimally invasive.
What is the feedback that you get from patients?
Well, you can see the patient discharged on the 3rd days after surgery, and then come back to the clinic the next week, and he or she can go back to work in 2 weeks.
Uh-huh.
Yeah.
Wow.
Unless she needs like a chemotherapy or radiation.
Right.
Yeah.
Of course.
If not, they can return to work very soon.
Tell us as briefly as you could some of the topics that you discussed or presented last night at the Guam Medical Association conference.
Well, last night was a very good meeting with the doctors here in Guam. That we show some of our works, and then we give them some ideas of minimally invasive surgery. What is it, and what's the future of minimally invasive surgery?
Okay. And would you say the future is bright?
Yeah, of course.
Okay.
Yes.
All right. Well, thank you so much, Dr. William Chen, for joining us on the show and for giving us your knowledge on minimally
It's
invasive
my pleasure.
surgery. Thank you so much.
Thank you.
All right. Well, we'll be right back with 2 more guests on our show right here in My Story. Don't go anywhere. Welcome back to My Story. I'm your host, Janella Carrera, and joining me for this segment of this episode of My Story is Dr. Wu and Dr. Li. They are from China Medical University Hospital in Taiwan. Thank you, and thank you for joining us here on the show, gentlemen. And welcome to Guam as well. This is your first time?
Yeah, it's my first time.
Oh, wow. Welcome to Guam. I'm going to start with Dr. Wu.
Yeah.
I know that you specialize in breast cancer surgery. And so, you know, I assume you have a lot of experience in cancer breast reconstruction. How long have you been practicing as a physician?
As a physician, more than 10 years. So I do I diagnose the breast cancer patient more than 200 patients per year, and I do more than 200 surgery, include the breast cancer treatment and the some benign tumor excision.
Okay, so here in Guam, typically when a woman is diagnosed with breast cancer, they're referred to an oncologist, and then if there is surgery needed, then they're referred to the surgeon. So, but your specialty focuses mainly on surgery.
Yeah.
Okay.
My focus in the breast cancer surgery, and it include maybe the traditional incision, just like the modified radical mastectomy. It was total remove the breast, and the other part is the partial mastectomy. It include the breast conserving surgery. The difference is the total mastectomy, maybe the multifocal lesion or the late stage breast cancer. But in past few years, and we always diagnose breast cancer in the early stage.
Early stages.
So we must develop a new method to treat the breast cancer, and we need to care the cosmetic result.
Okay.
So we develop some just like the oncoplastic surgery, and we can remodeling the breast, the defect. Previously, we just remove the cancer, and we can remodeling the breast and repair the defect, and then the cosmetic result is better than previous. We just done we just did the previous the surgery. Yeah.
Okay, so in the earlier stages, there is a higher chance of reconstruction as far as when you conduct the surgery. But in the later stages, it's a little bit more difficult, and that's when the mastectomy is performed.
Yeah. For the late stage of the breast cancer, we need to remove the whole breast. Maybe sometimes we can use the chemotherapy, we call it the neoadjuvant chemotherapy, to reduce the breast tumor size. Then we can do the breast conserving surgery after the chemotherapy. And sometimes we can reconstruction after the total mastectomy. And in Taiwan, in our hospital, we can create less than 7 centimeter wound, and that the breast conserving reconstruction and the wound is better, and the cosmetic result is better. Yeah.
So I'm trying to imagine how big of an incision.
Yeah, 7 centimeter, because we need to create at least a centimeter, because we need to remove the whole breast. We cannot do the very tiny
with a tiny one.
Yeah.
Okay. But you did mention earlier that there are some cases in which minimally invasive surgery could apply. I know I was speaking with Dr. Chen earlier about MIS. Are there instances for breast cancer, at least, in which you could use the method of MIS?
Sometimes we can use the MIS, but I mentioned before, and we need to remove the big specimen from the breast. So maybe minimal invasive is not very suitable for the breast surgery. But we still can create some special technique, just oncoplastic, just like the remodeling the defect and the better cosmetic result. And we have another service about the one-time service. One-time service is very special because after the breast conserving surgery, people should receive the radiation for the 6 to 7 weeks.
Right.
And traditional radiation is the time consumption, is time wasting,
right.
And especially people need to transfer to the house and to the hospital.
They have to travel.
So travel is not very convenient.
Yeah.
So maybe sometimes we develop the one-time, just use the IORT, intraoperative radio treatment, and just need the 8 minutes. We can do the high dose radiation during the surgery. During the surgery, so we can finish the surgery and the radiation in one time. And after the one-time treatment, and people can just receive the adjuvant treatment after the surgery and the radiation.
Okay.
So we can show the treatment time, and some report about the early receive the radiation can have a better local control.
Right. Yeah. Okay. Well, thank you very much for all of that. Now
you.
I'm going to go ahead and talk to you, Dr. Lee, about some of the work that you do. I know that you focus on bariatric and metabolic surgery, the upper GI tract. And so it's not just cancer that you treat, but a whole host of other diseases within that area. But as far as obesity is concerned, could you talk about how when you don't take care of your body, the foods that you eat, and obesity, how that could lead not just to cancer, but just all these other diseases if you don't take care of yourself?
Yeah, and we know obesity, especially morbid obesity, is high prevalence in the world recently, especially in American. In American is number 16th. The rank is number 16th in the world. In the world, yeah. So there are about 300,000 cases in America who receive this operation per year. Yeah. So because morbid obesity has several disease in our physiology, especially hypertension, diabetes, and joint arthritis. or other dyslipidemia or psychological problem. Yeah, so we need to treat this morbid obesity disease.
Right.
Yeah.
Right. Okay. And so when you were at the Guam Medical Association conference, I know you talked about the obesity rates and all of that stuff. What are some of the things that you presented to your colleagues last night? Some of the things that you talked about as far as surgery, I guess bariatric surgery.
Yeah.
What are some of the things that you could share with us here in Guam that we may not have as far as technology? Because I know in Taiwan it's very advanced at your hospital.
Yeah. Actually, in Taiwan, Taiwan is the first country in Asia Pacific perform bariatric surgery.
Wow.
Yeah, the first. So we perform bariatric surgery about 20 years in Taiwan, and now in Taiwan we perform bariatric surgery totally perform under laparoscope, under minimally invasive procedure.
Wow.
Yeah, it's very good, good data in Taiwan. Yeah, and we know obesity. The major problem is the diabetes prevalence is so high. So if we treat morbid obesity by laparoscope for this patient, and we can reduce the diabetes problem, especially in Taiwan or in other countries, people in Guam people, and we can help these people to solve this problem. Yeah.
Yeah. As far as cancer, though, how often do you come across a patient who developed cancer as maybe directly linked to obesity?
Yeah. Some kinds of cancer will link to be obesity, especially colorectal cancer or ovarian cancer. Yeah, but some, most of these two kinds of cancer link to obesity. Yeah.
I see. So you perform minimally invasive surgery.
Yeah.
Would you say all of the surgeries you do are?
Yeah.
Wow. So there's no surgery that you do that's traditional.
Traditional. Yeah, because if you do operation in traditional method, it's very difficult because in obese patient we have a thick abdominal wall. Yeah, so it's very difficult to perform by your hands. So we can use the invasive surgery, use the long instrument, to finish this operation.
Okay. What kind of training did you have to undergo, or any kind of schooling that you had to do?
Yeah, as the same as Dr. Chen. Yeah, we after we graduate from school, and we apply to surgical resident, and we practice the laparoscope training. And at first, we perform simple laparoscope surgery, for example, laparoscope appendectomy, and then cholecystectomy. But according to the paper in U.S., the bariatric surgery in upper GI is the most difficult surgery. Yeah, most difficult operation. Yeah, so we need to completely train by from step by step in this simple surgery to difficult surgery. Then we can apply difficult bariatric surgery.
Where did you go to train for minimally invasive surgery? Is it in Taiwan also?
Yeah, in Taiwan.
It's in
Yeah,
Taiwan.
because as I said, Taiwan is the first country perform
Bariatric
yeah,
surgery.
bariatric.
How
yeah.
long have you been a surgeon in Taiwan?
In Taiwan, about 15 years, and I performed bariatric surgery about 10 years.
15 years.
Yeah.
You look like you're only 25 years old. All right. Well, thank you so much, gentlemen, for joining us on this show and for giving us your input and expertise in surgery. We really appreciate it. And welcome to Guam once again, and I hope you enjoy the rest of your stay here.
Thank you.
All right. Well, again, that's Dr. Wu and Dr. Lee joining us from the China Medical University Hospital in Taichung, Taiwan. They are here in Guam for a conference. Don't go anywhere. We'll be right back to close out the show. Welcome back. Well, thank you again to Doctors William Chen, Yao Cheng Wu, and Ming Xiang Li for taking the time to sit down with us today and explain their role in treating cancer as well as the advances in technology and surgery. Here at My Story, we believe in providing a platform for the community to speak and learn more about cancer, whether it be warriors, survivors, caretakers, doctors, specialists, or advocates. We want to keep the community informed about how cancer affects our community so that one day we can prevent and eradicate it. We hope you tune in again for our next episode of My Story. Thank you for joining us. Until next time, have a good night.